can see. Hi everybody. So today I'm here on behalf of Real Life Physiotherapy and Rehabilitation, and I'm very thankful to the organizing committee, especially Dr. Avtar and Dr. Sandeep Vaishnav, for inviting me to take a lecture on this Parkinson's topic. And it is a very great to see that in this time of hardship, Real Life is renewing the definition of education. They are trying their best to impart the knowledge being at home, and this concept is really very good, and I think that this will go a long way in the field of medical science. So we are transforming and hope that the transformation continues for the good of the society. So friends, I am here to talk on the topic of Parkinson's. So I will be delivering this lecture through PPT, and I think you are, so I'm adjusting it. So as you can see, the topic is Parkinson's, recent advances and impact of artificial intelligence. So you all know that Parkinson is a brain disorder, and that leads to shaking, stiffness, difficulty in walking, and even there is a problem in the body balance as well as coordination. It is a progressive disease, and it progresses as the time passes, but due to this treatment and all that, we can delay the progression. And apart from having the body movement disorder, we can see mental and behavioral changes also in the subject who is suffering from the Parkinson's. There may be sleep problem, depression, memory difficulty, and fatigueness in performing any task. So if we see through gender wise, then men and women both can have the, but it has been found that 50% of the cases are more in men rather than women, and it had been seen in overall all the conditions that there is some percentage of less amount of prevalence in the women, and it is due to the hormonal factor of estrogen, and these do play some role in that. And we all know that this is a disease of elderly, and 90 to 95% of the cases are elderly, for the elderly. And if we will see that 5 to 10% case will be of early onset, and above 60 years it is considered to be the stage of early of elderly population, and below that 45 to 50 years is considered to be early onset. And nowadays we can also see juvenile Parkinson's also. This is also little bit 1 or 2% of the population is having juvenile Parkinson's. Early onset forms of Parkinson's are basically not inherited, and it may be linked to the gene mutation. There is mutation in the gene, and that may lead to the early onset of the Parkinson's, and it is not the inherited or hereditary disease. So agar we see the pathophysiology, we all know that dopamine is a substance which do function at the neuronal level and controls our movement, and which is being formed at the basal ganglia part known as substantia nigra, and there is accumulation of Lewy bodies. Lewy bodies is a type of a protein which do accumulate at those levels, and it hinders the production of the acetylcholine, and when it is in the midbrain, where then we can see the Parkinson's type of symptoms. Otherwise sometimes it is in the cortex level, then there is problem in the cognition of the subject, and this due to this sometimes we see that there is a cognitive problem also in the subject who is having an Parkinson's disease. So it is well defined that there are some cardinal signs in Parkinson's. That is, one of the thing is the bradykinesia, which means that slowness of the movement. Whenever we see the case of Parkinson, and we can identify it from far away by his gait or his functional activity, that he may be the case of Parkinson's, because there is slowness of the movement. Then there is muscular rigidity. Muscular rigidity means that the flexor and extensor aspect of the muscle, both movement is very you can say resistive. We will face resistance aspect of the movement, either in the flexion or extension. Then this leads to the less muscular movement. Then tremor is one of the main clinical feature when the subject is in resting position. So we can see that he is having tremors. There will be mild shaking in the hand, and as per the stages, I will come to the stage also. As per the stages, we can also find that whether the tremor belongs to which stage of the Parkinson's. Then there is postural instability, and that is very much evident, and as the case progress, the postural instability also increases. So there will be sudden fall in the subject who is having Parkinson's disease. Other symptoms may include like depression, emotional changes, difficulty in swallowing, because neck muscles are rigid, so they may have a problem in swallowing, chewing, speaking. When you will see the case of Parkinson's, then their voice is they are very slow in speaking. Constipation, urination problem, skin problem, and this sleep disruption is also common in these cases. Is all you know that it is slow, very slow stooped, and the stride length or the cadence is very short. So we can, an initiation of the gait is a bit difficult in the cases of Parkinson's. So as I said, that symptom of Parkinson and the rate of progression is there, but the progression rate may differ from one subject to other subject. It is not that a subject who has having same length of duration of Parkinson's may have same rate of progression. That may differ on subject to subject, and it is particularly it is on an individual basis. So it affects the people. Some may have a mild difficulty, tremors, or they may be having some other subject may have more severe that difficulty or the tremor, but the duration may be of same. That suppose a case is having 3 months of duration of Parkinson's, but one patient is doing his activity very nicely in that condition also, but other patient progression may be more and he may face difficulty in doing the activities such as writing, doing small activities. So these things will be differing from subject to subject. And how it can be noticed first? So we can see that the close associates of the subject, such as friends, family members, they can notice the changes in the subject, and they can only say that you are doing this movement slowly, or you are not doing it properly. Earlier you used to do it nicely, and they can notice and then let the subject know that there is some changes in you, and this will be noticed, and then the subject can be diagnosed as the Parkinson's. The one main feature is the face like mask expression. Mask like face is there, and that expression means that mask like face means he will be looking starey. There will be puffiness on the cheeks, redness over the cheeks, as you have seen the mask. Then that the face becomes like that, and you can also identify through the face also that the subject is having some type of Parkinson's feature. So symptoms often begin from one side of the body, and even in one more limb of one side, and as the disease progresses, it may eventually affect both the side. However, symptom of one side may be severe than from the other side. The tremors or movement may be more on one side and less on the other side, depending upon the clinic feature of the subject. Come to the stages of the Parkinson. It has been divided into 5 stages, and it is on the level of progression of the Parkinson's. So when we see the stages, then there are stage 1. Stage 1, there are mild symptoms. Subject will have the symptoms like tremors, slowness of the movement, rigidity, but in this case he will be doing all the activities fine, nicely. There will be no difficulty in performing the duty or whatever ADL he is doing. Then can say that he is having the symptoms and he is able to perform the task easily. Then this is stage 1. When we go for stage 2, we see then the same task which he used to do. Suppose he used to do buttoning very finely or nicely, but later on he finds difficulty in doing that movement, or whatever work he wants to start, the time duration has increased. The length of the time has increased. Suppose one activity he used to do in 10 to 15 seconds earlier, but what will happen, that as the duration will increase, the same activity he will be doing in 30 to 40 seconds. Though he will be able to perform the task, but the duration and the difficulty may have increased, and this will define that the subject is at the stage 2 level of the Parkinson's. Then stage 3, again there will be more difficulty, and this may be considered as the mid stage of the Parkinson's, because what happens that uh, here the subject is not dependent. He can do the work independently, but there will be significant problem in performing the task. Suppose he wants to eat also, then he will have some problem, and with some difficulty he will be performing that task. Still the subject is independent, but it is significant that the subject is having difficulty in dressing, eating, or doing any other activity. So here we can say that the subject is at the mid stage, and this is stage 3 of the person. So stage 4, symptoms are severe, and it's very limiting. The subject is not able to do the activities, and he needs assistance. So a little assistance, and whatever is to be done, he needs some assistance to perform his task. And you can say that the subject is not independent, he is partially dependent. So when it becomes partially dependent, where he needs to needs some assistance to perform any task, not full support but partial support in order to perform any activity. Then stage 5, where we can see the patient is mostly bedridden, and he needs a lot of support. You can say that full support even for ADLs like brushing, eating, dressing, and you can say that round the clock he needs some nursing care or nursing to perform his any ADL activity. So we can divide the Parkinson's symptom into two parts. One is the motor symptoms, and other is the non-motor symptoms. So as I said, that motor symptoms are the bradykinesia, movement of the muscle rigidity, then gait pattern, slowness of the gait pattern. These are the movement tremors. These are the movement symptoms. But other factors are also there, that is the non-motor function, and non-motor function, you can say that is the sign of early Parkinson's. If one complains of these non-motor symptoms, then one complain, or it can be noticed by the family or friend that earlier you were having this type of thing, and now you are not able to perform that thing. So this means that he is having some non-motor things, and non-motor things can be related to sleep, non-motor things can be related to cognitive changes, loss of smell or taste, because what happens that when the Lewy bodies is there near the olfactory region and all that, then there is a problem in loss of smell and taste, mood disorder, depression, anxiety, irritability, sleep disorder is there, sexual disorder is there, urine and urgency is there, frequent incontinence, vision problem,